Good evening, good evening, good evening, and welcome to the second district COVID-19 monthly webinar series. I will be your host, I'm your moderator, the second district representative of the Omega Psi Phi Fraternity Incorporated. My name is Kelvin Ampofo, and it is a pleasure, it is an honor to be before you tonight. We have a distinguished panel as usual. First of all, let me just say thank you to our friends, our family, our guests. Shout out to our brothers and sisters from the National Panhellenic Council, everyone that's been with us since the beginning of this pandemic. And so we continue to bring live information. We continue to bring updated information from reliable sources, our doctors from the greatest fraternity, the Omega Psi Phi Fraternity Incorporated. On behalf of our Grand Bosselist, Dr. David E. Marion, our first Vice Grand Bosselist, Brother Ricky Lewis, we certainly extend our greetings to you and your families during this holiday season. And certainly on behalf of the brothers of the mighty second district, which is comprised of the states of New York, New Jersey, Pennsylvania, Delaware, and Maryland. With no further ado, let's again meet and greet our four horsemen of the second district. First one we know is 1978. We call him Dr. Boykin, retired pediatrician, who gives us the stats. He gives us the information and just Dr. Boykin, we thank you so much for all the time that you've been with us. Please go ahead and give us your introduction for the night.
Well, good evening to everyone. Welcome, welcome, welcome. I hope everybody had a wonderful and safe holiday season so far. I only want to say to you tonight that the statistics probably, you can go and look them up anywhere you want to, but we all know that they're going up. Omicron is going absolutely bonkers in our community right now. So, you need to pay attention to that. You need to pay attention to what you're being told. But most importantly, the best way to combat all this is get vaccinated. Get vaccinated, because that's what we need to try to get some type of handle on this pandemic. And the other thing I want to say to you is please, please, please get your flu shot. This is already starting to be a horrible flu season. We're seeing cases of the flu going up. And flu, unfortunately, affects our pediatric population as well as our elderly population with worst case scenarios. So we don't want to see our statistics continue to rise in terms of cases of COVID, deaths from COVID, hospitalizations for COVID, because the hospitals are already overwhelmed. And, the whole issue of infrastructure is impacted by this thing. And I want to leave you just one note to keep in the back of your mind. Right now, as of this moment, according to data that I've reviewed from the American Academy of Pediatrics, there have been over 1,000 pediatric deaths from COVID-19. So I want you to think about that and mull on that. And I'll yield back my time because we have a lot of interesting things I'd like to get into tonight, but I want to yield back my time to the other panelists, Brother DR.
Thank you so much. As always, Dr. Boykin, giving us the facts, giving it to us quick and hard, and we thank you for that. Let's go to our next brother, who we call 88. Brother has no problem telling it to you just the way it is. And sometimes, all the times, that's what we need to hear. This thing is serious, and people aren't taking it seriously. So with no further ado, the doctor that's been there since the epicenter, right there in New York, 88, Dr. Jedan Phillips. You have the floor, my good brother.
Well, good evening, my brothers. Good evening, general public. Again, I think this is a critical time for us to have this conversation. Again, I am a family doctor, so in my work today, a predominant amount of it was diagnosing people with possible COVID, dealing with the questions that come when you have COVID, and unfortunately dealing with some of the logistical impacts that COVID has. And the unfortunate piece, and I'll just carry on to what, as we refer to 78, or the point of the spear, just said, we are seeing an amazingly alarming increase in our number of pediatric cases, along with pediatric hospitalizations. So again, y'all, our most vulnerable are unfortunately the low-hanging fruit right now, and we've got to do our part to make sure that we protect them and other vulnerable members of our community. So with that, excited for our conversation tonight, and I yield my time. Thank you.
Well, thank you so much, Dr. Phillips. 88, we're going to move to 1990. And for those of you that are just joining us for the first time, this brother has a tremendous story. He's been with us since the beginning while dealing personally with the challenges as it relates to this pandemic. But most importantly, as a federal government employee, he gives it to us straight. Brother Wonzie Gardner, it's such a pleasure to see you. My brother, we're going to yield to you for your opening comments.
Brother DR, and to my esteemed colleagues of Four Horsemen, and to my brothers of the greatest fraternity in the world, and to our guest tonight, I want to say thank you for allowing me to be a part of this conversation. As Brother DR talked about it, we've been on this journey a long time, and I just hope I can add some value to this conversation tonight. I'm surrounded by all these doctors, and so I'm just a little journeyman from the south side of Georgia, as they say, and here to add anything to the conversation. So, Brother DR, thank you again for this opportunity. Look forward to the conversation. Thank you.
Thank you, Brother Gardner. Last and certainly not least, we call him the Four Horsemen. And this doctor from the pharmacy side, we talking about vaccines. You want questions? You have questions? He's got answers. So with that being said, 91, Dr. Guyton, welcome. Good evening, my brother.
Good evening, Brother DR, and to our distinguished panel, the Four Horsemen. It is just a pleasure to follow these great brothers into the fraternity as well as tonight. I want to thank all the brothers who are online and say Happy New Year, Merry Christmas, and Happy Holidays. It is a blessing to be seen in the number as we as a country and the world has been through the worst pandemic in history. We are still fighting on multiple fronts with misinformation, with disinformation, as well as fighting the fact that Omicron is attacking us at numbers that we've never seen before. We'll discuss some of those things and how we may be impacted further and how you can, in your community, increase your numbers. I'll just say this, even in the second district, there are only 2 states greater than 20% vaccinated in the minority communities. Only 2 states that have greater than 20% of this community that we love and we serve as a divine line that are vaccinated. Nationally, only 10% of African Americans are vaccinated. So let's start with that baseline, and we got plenty of room to grow. Thank you again, brothers.
Thank you so much, Dr. Guyton, and to all of you, the Four Horsemen. Again, it's always a pleasure to be before you. To our guests, to our families that are watching, must give you this very, very, very important disclaimer that I ask that you are mindful that the comments that you hear tonight, anything that's expressed by individuals tonight, it's exactly their own comments. They do not reflect the Omega Psi Phi Fraternity Incorporated or any organizations or affiliates that they may be affiliated with. With that being said, let's get right into it. Dr. Guyton, we're going to start with you. As the pharmacist, vaccines, talk to us. You got the floor.
So, brother, and to our esteemed guests, let me say the bottom line up front. Get vaccinated. What the CDC has said in the last week that the unvaccinated are 10 times more likely to catch the Omicron, 20 times more likely to be a fatality. Take those numbers in. The vaccine has been proven to prevent and save your lives for almost a year now. The very simple answer to you is yes, the vaccines are safe. Yes, the vaccines are free. Yes, the vaccines are available. And yes, they will save your life. Now, you're 17 times more likely to be hospitalized if you're unvaccinated and you are afflicted with Omicron. Omicron is not as virulent, but it is more contagious than any of the previous variants. What do you mean? It means that you're more likely to catch it, but if you're vaccinated, you're more likely not to require hospitalization. Why is that important? Why are we worried about that? Our hospitals are full. Looking at regions 1 through 4, which is your whole East Coast, we're right now at the limit of hospitalizations in multiple states, the Midwest as well. When we talked about fatigue, our healthcare fatigue before, now let's compound it with infrastructure failure, hospital infrastructure failure. Well, now, what does that mean? It means that the routine health visit that you need, the routine, if you have a heart attack or you need to go in for a birth, you will be turned away if your hospital has too many COVID patients. And understand something. When your hospital becomes a COVID hospital, the whole dynamic of care changes. You become lower on the totem pole of care in the care pendulum. Let's understand, we have heard so many of the out-of-the-box remedies. We're not talking ivermectin anymore. We know that doesn't work. Hydroxychloroquine doesn't work. We now have to be very careful. If you're going to also get the monoclonal antibodies, there are criteria set forth that you have to meet. So monoclonal antibodies are not a guarantee. I just had a nurse provider, Native American, call me, who works as a nurse practitioner out of Arizona. She got sick at work. They turned her away because she didn't qualify for the monoclonal antibodies. She's frontline nurse practitioner. Native Americans, by the way, Native American and African Americans are the mostly impacted by getting infected by Omicron right now. Yet they're turning them away. I have nurses who are my colleagues from college. Grady, one of the biggest hospitals down in Atlanta, in one day on her shift, she had over 90 COVID-19 infections from Omicron. One shift, that's 8 hours. So brothers, sisters, we need to really start again, go back to the basics, distance, masking, and making sure that you have your hand washing. Now, mask. There has been a lot that discussed about mask early on. With this new Omicron, we really have to be very careful about when we say masking. The surgical mask, the KN95, N95, those are recommended, not the cloth mask. Because right now, as virulent as Omicron is, you can still have particles go through those face masks. Take it from a guy who's flown in the last 2 weeks. I had 2 masks on. I had a surgical mask on, and I had a cloth mask on with a 0.2 micron filter that I got. That means I took my mask and put a filter inside of it. So I had 3 layers. That's how dangerous it is. Those are the numbers that we are seeing. And January will be a very hard month for this country. You're seeing now economically the impact that are happening with the National Football League, the NHL. And let's go back to plainly when you couldn't fly home for Christmas on your airplane, or when you sit right here behind me at Amtrak and you're delayed 12 hours on a train. So the normalcy in life that we've had, the lull that we thought we were out of this, is going to come crashing back down if we do not, as a community, become our COVID ambassadors and go back to the basics. I'll yield my time back there, brother.
Dr. Guyton, we appreciate that. I mean, just phenomenal information. Those of you that are online, any questions, throw them into the comments, throw them into the chat. Right now, we're going to do something special for the ladies. All right. We have a special doctor that's with us. Let me introduce the Reverend Dr. Beverly Waddell Jiggets, born and raised in Greensboro, North Carolina. And attended the public school there. She's graduated summa cum laude from Hampton University. She's got a BA in biology. She earned a medical degree from the University of North Carolina at Chapel Hill. So, with no further ado, also let me also mention that she represents the ladies of Alpha Kappa Alpha Sorority Incorporated. Dr. Waddell Jiggets, please, the floor is yours.
Thank you. I hope you can hear me. Unfortunately, I had some technical difficulties with my computer, so I'm doing this on my phone. First of all, thank you so much for including me in the panel. I think this is a topic that we just cannot discuss enough. What I'd like to do I am a practicing OBGYN or recently retired practicing OBGYN. So I would, first of all, just like to appeal to all women to be vaccinated. As has already been said, the vaccines are safe and they are effective. And I hope also tonight to allay fears of pregnant women about the vaccine. The vaccine is also safe in pregnancy and it's very effective. And it's needed because the data do show that pregnant women who have a COVID infection rather, are twice as likely to have severe infection, to progress to severe infection, as those women in the same age, same demographics that aren't pregnant. And 97% of pregnant women who are hospitalized due to COVID are unvaccinated. 97%. And despite that, only a third of pregnant women, all pregnant women, have been vaccinated. And in the African American community, that number is even lower. It's less than a quarter of African American women who are pregnant have been vaccinated against COVID-19. Severe infection means not only hospitalization, it means increased chance of being admitted into the intensive care unit. It means increased chance of needing ventilator support. And the infection not only affects the mother, it also affects and complicates the pregnancy. Women who have a COVID infection, a severe infection, are much more likely to deliver prematurely. They're also more likely to have deliver a stillbirth. Much has been said in the last few years, and much concern has been raised about healthcare disparities. And there's been concern about why African American women who are pregnant don't have as good of outcomes as other groups. And there are many reasons for that. But this is something that is affecting pregnancy and affecting pregnancy outcomes and affecting pregnant women that we can control. These complications are preventable by getting one of the COVID vaccines. They can be given at any time during pregnancy, so you don't have to wait until after first trimester. They can be given at any time during pregnancy. And for those of you who are saying, well, it's too late for me because I'm at the end of pregnancy, the vaccine still is important because the data also show that the risk of having a severe infection it persists up to 7 weeks postpartum. So 7 weeks after you deliver the baby, those ladies who are recently pregnant are still at increased risk for severe infection. So if you didn't get vaccinated during the pregnancy and you're just delivered, the vaccine still remains important for you because, again, the vaccines are safe, they're effective. Women have been followed who have gotten the vaccine. There is no increase in the rate of miscarriage in ladies who receive the vaccine. There is no increased rate of other pregnancy complications because of the vaccine. It's safe and effective. And because it is safe and effective, numerous groups like ACOG, American College of OBGYN, the Society for Maternal Fetal Medicine, that's the organization that represents perinatologists. Perinatologists are the OBGYNs who take care of high-risk pregnancies. NMA, which is the National Medical Association, that's the association that represents African American physicians, the National Hispanic Physician Association, all those groups, and I'm just naming a few of them, have endorsed getting one of the COVID vaccines. One other thing I want to address, and I'll yield my time, is there's also unfortunately been misinformation that just won't die that says that women who get one of the COVID vaccines will suffer from infertility. That is just absolutely not true. There is no data that shows that getting a vaccine, COVID vaccination, causes infertility. So for those women who are thinking about getting pregnant either now or in the future, there's no reason to not get the vaccine because of concerns about infertility. For parents who are concerned that vaccinating their children may in the future impair their fertility. There's no data to support that. So again, I would like to encourage everyone in general, and as an OBGYN, women in particular, to please get vaccinated.
Thank you so much.
Thank you so much, Dr. Ziggins.
Just do us a favor.
Do us a favor.
Make sure you
Make
place
sure you place yourself on mute
so we don't
get that feedback.
Okay.
Thank you. Yes, but hey, that information was phenomenal. And Dr. Jiggins, go ahead, get ready to come off of mute. So I'm gonna go ahead to one question that we already got. Looks like Colonel Bracey. His question is, why won't the women take the vaccine? Unfortunately, he just lost a good female friend for that reason. Your response.
I think the main reason is fear. And I appreciate as, when women are pregnant, I always say, and I always frown at cards for Mother's Day to say mother to be, because once you are pregnant, you are a mother, and the decisions that you make during pregnancy impact your infant. So I appreciate that women are concerned about the potential risks of the vaccine. And unfortunately, the misinformation, the people who are spreading misinformation seem to be much louder and have a much wider platform than folks who are given true information. And so concerns, again, about miscarriage, concern about pregnancy complications, all that misinformation that has been spread, I think, has greatly impacted women's desire to get the vaccine. They are concerned that it will be a problem. And, I think, too, most pregnant women are younger. And so there is a certain aspect of, it's not going to happen to me. It may happen to somebody else, but it's not going to happen to me. And unfortunately, probably most of us in this panel discussion and most people in general know somebody now who's been affected by and infected by COVID. So we can't take the attitude that it's not going to happen to me, because it very well can be you.
All right,
thanks.
I just wanted to add.
We need you to go on mute,
Doc.
I just wanted to add to that. I think another, as Dr. Waddell Jiggins mentioned earlier about healthcare disparities, one of the biggest disparities we have is the quality of prenatal care for women of color. Now, I'm definitely not talking about Dr. Beverly when I speak about that, but unfortunately, too many of our sisters are in positions where they're not getting quality medical prenatal care. And without that, there's also the lack of having a resource to get their questions answered. So you're leaving people out here to figure it out and let Dr. Facebook or Dr. YouTube step up as their gynecologist. And I think it's important to really hold our healthcare providers to task. And for those that give you I think you should wait till we get more information, a lot of times what that means is they don't know. They're not educating themselves. And I think it's important for all of us that are on the healthcare providing side to become somewhat knowledgeable about what is going on in a general sense, so that we can give quality information to our patients, like our prenatal women, so that they can make the best decisions. Because right now, as the doc just said, we are seeing an impact on our pregnant women in a way we haven't seen in things before.
If I could just add one quick statistic to that. I like my statistics, Brother DR. If you look at the vaccination rates amongst the sexes, male versus female, the good news is that females outnumber the males getting their vaccine. So that's a good thing. But we need to continue to encourage our females to get the vaccine, because when they go through the pregnancy and they have complications, they don't take the vaccine, then the pregnancy yields a very sick infant that I have to take care of as a pediatrician. So that takes care of resources for my other kids I am retired, but I was speaking for pediatricians in general. That takes away from resources for those pediatricians being able to focus their time on the other things that infant may need, such as the vaccination with hepatitis B at birth and so forth and so on. So, we have got to make sure that those populations are getting vaccinated. Even though the numbers are good, we still need more.
Brother DR, can I make a comment, please, as a non-doctor? Because we talk about this quite a bit, and for those in the DC metro area, there was an article in the paper today that talks about Prince George's County and Maryland in general about with regards to being vaccinated. And I think Black Americans are like 15 to 20% below their white Americans getting the booster shot, according to the article. But as we talk about this, sometimes is we have to look at it from a different perspective. This is not a medical issue. Because the medical doctor, you on the front line, it's there. The resource is there. The ability to go get a shot is there. And so I guess the question is how do we incentivize, or how do we look at this from a perspective of what will it take to get Black America, our brothers and sisters, motivated to protect themselves? Because for the last 21 months, and especially on this show and others, you have done a tremendous job, an amazing job of talking about the tools out there, the things you can go do and all that kind of stuff. But as I sit here and listen to Dr. Beverly Waddell Jigget talk and my other brothers here, the information is there. So the question I guess I would ask or pose is, how do we incentivize ourselves, our community, to recognize that, yeah, there were situations where we couldn't trust medicine before, but we're beyond that. How do we get people to be incentivized when every night you see on television over 800,000 Americans have died? And so I don't want to insult anybody's intelligence, but what more can you do? How do you reframe this situation, this question, this issue in a way that you reach a person to where they are? Because we've done a great job, but something is missing because we're not meeting people where they are. And I guess the question I have is how do we meet people where they are, not bring them where I am or my way of thinking, but how do I reach them where they are, to where they understand the immediacy, the importance of this, not only for themselves, but for society, because society is changing. Thank you, Brother DR.
If I could, Brother DR, I've been on many webinars and seminars with just that question posed, Brother Wonzie. And I think one of the points that's missing, you make a very good point, that how do we reach them? And we speak to audience on a generic basis a lot of times, but we forget that the role models that our younger people are seeing are not the same role models that we have or the same focus we have. So we have to reach them where they are in terms of one of the biggest points of misinformation are the celebrities that they look up to all the time. And I can't say enough about how much time that's been misread. So we need to have those people that are advocates for vaccination in those particular communities they look up to endorse the vaccine on a non-threatening basis, because we cannot afford to have them continue to spread misinformation out there. And the second thing, for the younger, those even younger than those, they use a lot of electronic devices, a lot of gaming, a lot of things like that. And I don't think that platform has been tapped into in terms of getting information out there to that to those younger people. So those are a couple of areas that I know of that we can probably address some of the issues with. I would love to have a webinar or information more on our undergraduate and even our high school people. I do sit on a fatherhood committee in the fraternity in the 2nd district that I do speak to them, not so much about COVID-19, but I answer some of their fears being young people. And I do tell them how they can survive the COVID-19 pandemic. But that's one of the areas that I do, but we need more of that. We need more addressing those celebrities that they look up to, addressing those social media platforms they look up to, and addressing those games and electronic devices that they use a lot for their information. Because I can tell you that they will go on to Facebook and say, oh yeah, I saw that people that have O positive blood would never get COVID. Well, that's a big myth. What the heck is blood type O positive got to do with getting COVID? Or I heard if you go XYZ and you do this, because my friend on Instagram said you're not gonna get this COVID-19 if you do this. Those are the areas we have to attack. And fortunately enough, AAP, the COVID-19 Task Force Committee, have some media out there for just that purposes. We're just not utilizing enough. And I'm just as guilty as anyone else for not putting it out on my Facebook feeds as well. But those are some of the areas that I see that we're not tapping into.
Let's go, Dr. Phillips. Let's go into some specifics, right? So let's face it. Everybody knows somebody that has either been infected, currently is infected, or has come into close contact with somebody. So, Dr. Phillips, from what you've seen, what do people do? Either they've tested positive now, or they know they've come into close contact with somebody. What should people be doing if they're either infected or come into close contact with someone?
Well, the first thing I want to say is just two quick points to add what Brother Guyton and Brother Boykin were talking about, which is in that message, we need to make sure that the language is understandable to the common man. If we're sitting here talking about messenger RNA and efficacy and things of that nature, a person may not understand it. Additionally, how do you connect the consequences of COVID or not being vaccinated to their real life circumstances? And I think taking the time to explain it in that way, some people say, wow, I didn't think about it, that it could affect me in this way. And it has nothing to do with COVID, but it does still have a significant impact. So to your question, Brother DR, if I'm a person who suspects that I might have an exposure or am I having symptoms, the first thing I'm going to do is reach out to my doctor. Now, unfortunately, a lot of people in the United States don't have a primary care doctor. So unfortunately, you know what happens is they are out at City MD or an urgent care center. And like in Georgia, like in New York, the line is around the block. I know my mother waited in line to get a test before we got together for Christmas. She was in line in New York for 2 hours in 40-degree weather. So unfortunately, those circumstances make it very, very challenging. However, in the doctor's office, we actually have circumstances that we can adjust the safety parameters to take care of patients that may be a person under interest. In addition to that, we have the ability to also do telehealth visits. And from those spaces, we can initiate the process, getting a test done. In my office today, I diagnosed 5 people already today with COVID, and we have rapid tests in the office. So with that, we can then do a risk assessment. Is this somebody who's at a high risk? Meaning, are they over the age of 65? Are they over the age of 50 and they have complicated or chronic medical issues? Because at that point, the other thing that your doctor or healthcare provider is going to do, he or she is going to connect you to possibly monoclonal antibodies, because those are one of the remedies or support mechanisms that are available to assist you earlier on. The other thing that I'm finding is, okay, say I live in a house where it's 3 other people in the house, but we all have our rooms. How do we quarantine safely? How long do we quarantine? How do we exchange or function in common spaces like the kitchen, the bathroom, or things of that nature? What are the steps where I can exit from quarantine? You know, about the 48 hours not having any symptoms and not requiring any symptom relieving medication. Now, the other part, which is the unfortunate part where we as healthcare providers got to lean on our patients, is sometimes they want to make the rules adjust to what they would like to do. So I had some people, well, I got a birthday party, but it's on day 6 of my quarantine. Am I good to go? I said, are you still having symptoms? Yeah, so you're not good to go. I just wanted to ask you. But again, you know, these are the type of circumstances that you can at least bounce off your doctor. Because unfortunately, you got some people who are trying to accommodate their life choices with fitting COVID rules and regulations around it. And unfortunately, as was said earlier, with this higher infective variant, it's spreading like wildfire. And it's not an issue of people necessarily getting sick. It's my patient today who just found out that she has a breast lump in a lump in her left breast that has to have surgery in the beginning of January. And now they're talking about possibly delaying it. These are the consequences. It's my patient who came in and has 3 children under the age of 5 years old, and there's no vaccine available. So again, you know, it's not just about what we want to do. It's also about how can we support and help those that are more vulnerable to this pandemic than we are in the society right now. I hope that answers your question, sir.
Yeah, Dr. Guyton and Brother Gardner. Let me come to you on a different topic, but let me see. Dr. Boykin, is there anything you want to add to what Dr. Phillips said before? I got a question for Dr. Guyton and Brother Gardner. Dr. Boykin.
I'm sorry, I was trying to unmute that. No, I think you hit the points very thoroughly there. People are making up. They look at the media is telling them one thing, not telling them the whole picture. I think that's the most important thing. They hear the number 5, they hear the number 5, but they don't realize you got to be asymptomatic and follow those particular guidelines. So we can't have people out there making it up to fit their particular scenario or whatever they want to do. You got to follow the strict guidelines. If you ever want to break the cycle, you got to follow the guidelines. And if you don't know, or if you're not sure someone knows what they're talking about, then ask your PCP. If they don't know, ask the next person. You can always go to the CDC's website and find out exactly what it is you need to do. The CDC's website is not just for physicians. It's for anybody, laypersons included, who want to go and get the information. So I just want to put that out there that's there for you if you want to understand. Please don't take what you hear on the news as the gospel. Pardon me, Bev, the gospel according to St. Luke, but because you need to know the actual details of it. So that's all I want to add to now. You.
All right, thanks, Dr. Boykin. Dr. Guyton and Brother Gardner, I want to come to you with a question, but let me just check. Dr. Guyton, seems like you want to add something to that. Let me let you add something quickly, and then we're going to go into the topic for you.
No, I just want to go back to the basics. You make it to the point where the patient understands it's something that personally impacts them. Mothers, the only way I got one of my friends vaccinated is 2 of her daughters caught COVID. So you have to make it, personalize it. And we all can do that as COVID ambassadors. But what we can't do is make it a negative. Have the open-ended questions. Have the conversation. Be supportive. And I'll stop there.
Dr. Guyton and Brother Gardner, if you guys can talk to us about, Dr. Phillips mentioned this thing about quarantine. So quarantine, as far as whether you have symptoms, quarantine, whether or not you tested positive, and at least from the federal government side, what is the requirements right now as far as employees? If they have tested positive versus if they've been in close proximity with someone, what are people doing? What are they supposed to be doing as it relates to that?
Brother Guyton, you want to take a shot at it first?
Yeah, Brother Gardner, go ahead.
Okay,
now
first.
We always 91.
Hey, listen now, but I honor your specialty. The federal government is wrestling with that right now, and I think that a lot of other entities will follow the same suit. As you all are probably aware, the CDC came up with new guidelines on the 27th of December for isolation and quarantine. And for isolation, the new guidelines is if you test positive, whether you've been vaccinated or unvaccinated, whatever it is, if you have tested positive, you're supposed to stay home for 5 days at a minimum. If you have no symptoms after 5 days, you can't leave your house. But for the next 5 days, you're supposed to keep that mask on, whatever you're doing. So if you have been vaccinated, or if you've been isolated because you've been infected, it's 5 days isolation and then 5 days with a mask on. Quarantine is a little bit different. This is where all the confusion gets in place, where they're trying to figure it out, what we really mean by quarantine. That's considered the time following exposure to a virus or close contact. I haven't got it, but somebody around me got it. And why that's so important right now is the transmissibility of Omicron is so big that this nearly affects everybody. And so this quarantine thing is something that we're still wrestling with to try to figure it out. But right now it says if you have been boosted, you've been exposed to somebody, or completed the primary series of Pfizer or Moderna within the last 6 months, or completed your primary series of J&J with the last 2 months, you are to wear a mask around others for 10 days and test on the 5th day if possible. So if you've been exposed to someone, but you haven't had any symptoms, or you're not infected, wear a mask for 10 days. And on the 5th day, if possible, get a test. Now, Brother Guyton hit on this earlier. Some say it was a mistake by the federal government. I won't say it's a mistake because we didn't order enough tests. Nobody knew that Omicron was going to rear its ugly head the way it is. I hate Monday morning quarterbacks. I think from a sociological standpoint, the administration, and Cedric can talk more about this, are doing as best they can about getting those rapid tests. I mean, the president's put the Defense Production Act in place. We're going to get more out there, but nobody knew. The problem now is that this thing hit us at a time of high travel for people during the holiday seasons. And so everybody want to get tested because they want to go home and see Big Mama, because we haven't seen Big Mama in a long time. And that's what they're supposed to do. And so we have kind of created the need for us to get all these tests out there. And so what we're trying to do right now is get more clarity on what it means to isolate and what it means to quarantine. Now, let me give you a real life example. Right now, we talk about how Omicron is more transmissible than the other vaccine, other variants, right? So in reality, and this is what I call real talk, we need to remove the stigma of becoming infected, because you can do all the right things and still become infected, right? And so we need to make sure that people understand that just because you've got vaccinated, just because you got a booster, just because you wore a mask, this variant is so insidious, it can go through all that, okay? And so what we're trying to say is, when they talk about quarantine, is if you know you've been someplace, try not to spread it, right? And so one of the things I like about this is we try to break it down for us. If your nose is running, you feel bad, chances are right now something's going on with you, right? And you need to stay away from everybody. Brother Phillips, Dr. Phillips said something earlier, but in our neighborhood, in the hood where we live normally, we have multi-generational families a lot of times. Where Big Mama taking care of her kids, and so on, and all that kind of stuff. So we have what we call very blended families. So it's very, very hard. And so one of the questions I like to pose back, and Brother Guyton, you can take from here, is how do we quarantine? How do we isolate the way we live and how we live? Some ideas that we can help each other. Because it's one thing to throw out something, but it's another thing to give a solution or how we try to do this, or some kind of way to work around it. So with that, Cedric, I'd like to turn over to you to give you your input from your doctoral position.
So let me start first by bringing up the fact that the stigma of having COVID needs to be one of preventing us from getting COVID. You know, having COVID at this point is not a death wish for those that are vaccinated. There's a stigma. So psychologically, we as COVID ambassadors can relieve and help push that stigma aside. That's how we can address that. You know, how do we live as a blended group? How do we deal with the mothers in our neighborhoods? So usually a central focal point in our family. Vaccines. We are not sitting here with a problem that does not have a solution. We have a solution. The solution is you get the family vaccinated. You get the family to understand that when they're out interacting, because it's really not going to be the problem in the home. It's when the babies go to school, when the adolescent goes to middle school, or when the high schooler goes out, that we're going to have those risk factors exponentially increase. Because Big Mama going to keep you home, and she's going to make sure you follow the rules. Mm-hmm. She's going to make sure you're vaccinated. She's going to make sure that you go to the doctor if need, but she's not going to control that 13 to 17-year-old that's interacting with their friends at school. I myself, my daughter has had been quarantined and has had COVID. I've had to live through that nightmare prior to being vaccinated. So, you know, there is the opportunity that all of us, we can speak the same language, doctors or not. It is get vaccinated. Understand. Let me go back to the 5 days things. I'll put my epidemiology hat on. It has been found that the reason why they said 5 days is that within that 5 days, 85% of the people are going to be then during that time be able to pass the virus on. After the 5 days, it exponentially goes down. So what they're trying to do is capture the largest number of people who are going to be impacted and infected at that time, while looking at the psychological impacts, the economic impact of trying to keep people home 10 days after being in this state for 21 months. CDC is finally being realistic. So I want you to understand the numbers are there. The solutions are be a COVID ambassador, get vaccinated, make sure you have the right mask, protect the most vulnerable, our big mamas and our kids. That's how we can deal with the stigma in our communities.
Brother DR, can I add to the backside of that? And I think it's very important, especially talks like this. We should never allow ourselves to get boxed in by something we said 6 months ago and be held to it. Because as we learn more, like Brother Guyton just said, we evolve with our thoughts, we evolve with our thinking, we evolve with our processes. One of the biggest things we battle from where I sit in the federal government side is people say, well, you said this yesterday or last week. And that hampers development, hampers growth, because as we learn more, not only on the medical side, but how this thing reacts with society and economies, we have to adjust. And Brother Guyton just made a very good point. 5 days, 85%. So from a societal standpoint, you got to make adjustments. A lot of people look at that as being unprepared on the weekend. I look at it the other way. Brother
Dr.
Beverly.
Jacobs, please. Sir.
And so we look at it the other way. It's not that we're being weak because we're adjusting. It's showing our agility, our flexibility, and our dexterity that we're seeing a new data point that allows us to make this change. So the other thing we need to do is remind people, just because we said something yesterday, when we get new data today or tomorrow, it will change. And this thing is always evolving. And that's something we've got to keep in the forefront as we have these kind of discussions. Thank you.
I would like to offer that as one of our major components within our community that we have to address. Whether one of it's misinformation and disinformation, correct. The other one is the ability for the change to happen. If the data changes, if the situation changes, we have to change. If evolution in our lives daily. Some of the behavioral health issues that we're seeing are because people are not able to adjust to the stress that this situation is putting on them. Our community is seeing exponential growth in opioid abuse. They're seeing growth in suicide. They're seeing growth in spousal battery. Why? The stress and the lack of adaptation within our societal building block for African-American communities. Let's make this an easy choice. Get vaccinated. Put the family before your insecurities because there's a solution out there to this problem. Over.
Let me ask this. This is something that obviously between our organizations, I'm talking about congregating. I'm talking about meetings. I'm talking about joining together. Right. So obviously the holidays they continue. New Year's is around the corner. 88. I already know your position, right? But there's brothers on here. They haven't seen each other in a while. First thing is from a fraternity perspective, our meetings. From a sorority perspective, your meetings, obviously churches. So just in general, let's start with Dr. Phillips. Your take on meetings and gatherings and that things of that nature.
Well, the first thing I would say is me out here in Long Island, New York, can't tell you what's going on down in Maryland. And I think that the first thing we've got to do is be aware of what our local incidents are of COVID. If you're in New York, where we're at a 20% positivity rate, which means for every 100 tests that they do, 20 of them are positive. The goal that we tried to have in early part is for it to be less than 1%. That means you're doing good. We are at 20% right now. So with that being said, gatherings like what you just described would not be the smartest thing. The other thing that we've got to consider is, I know for me, a great brother in our fraternity just passed, and his funeral was Monday. And I'm coming from New York. I'm working in a healthcare situation. I could very well be bringing it in an asymptomatic way down there. And that's the last thing that I would want to do. And as hard as it was for me to do that, I had to exercise some restraint because, unfortunately, big brother and big sister COVID don't care about your circumstances. They don't care whether it's a legitimate reason. I've missed you, my brother. Now, the other thing I know is if I see you, Kelvin, if I see you, Keith, Wonzie, Ced, and you, Beverly, I want to give you a hug. And I got to recognize my weaknesses so that I don't put myself in this situation. Now, I'm going to quickly flip to my practice. And of the over 10 cases of COVID that I've diagnosed in probably the last 5 days, the common theme has been being a little too loose. All of them was a little too loose. And they could sit there and say to me, you know what? I went to this event, or my father came over. All of these different situations and circumstances where we let our guard down. So with that being said, we've got to look at it, because we're not even at the peak yet. What they're expecting is probably mid to late January, we may see what this ultimately becomes. But right now, We need to focus on how do we make sure that the 6 people that I see on here right now, that we see each other the next time we're together, because if we are not careful, and as we know, the unpredictable nature of this COVID, even though you're vaccinated, you could be that 1 in a million. Or like you said, Brother Gardner, we live in multi-generational households. If we want to spend time, then we're going to need to make sure that we mask, that we get the vaccine. And the last thing, and I think that we should talk about, is how is it most appropriate to utilize the testing? Because unfortunately, sometimes, like when we were talking about the antiviral pill at our last meeting, that people said, well, that's going to get us out of COVID. No, it's not. Testing ain't going to get us out of COVID. However, it's important for us to know how to properly use testing and these home tests. Like if I was going to see someone or travel somewhere, maybe right before I depart, that's when I would do a home test. But again, these are all the nuances that it's so important to make sure that you have engaged your healthcare provider so that you have better information than what I find on Facebook and YouTube and Instagram, which it unfortunately seems to be where a lot of people rely on getting their information on how to exist and live within this COVID pandemic.
Dr. Boykin, please, your comments on gatherings.
Well, I've gotten many calls as one of the quote unquote 4 horsemen in the last few days about gathering in person, and Dr. Phillips hits it right on the head. And my personal opinion is that we should forego any in-person gatherings at the present time, particularly because the rapidity of which Omicron is spread. Now, there's one little population we keep forgetting to talk about in this particular situation. Let's talk about the home situation, if you will. Now, pediatric patients, they may not be as sick as the next patient when they get Omicron or something like that, but they are highly transmissible. Highly transmissible. If you look at the number of cases, particularly, and Dr. Phillips can certainly speak out more than I can, but in New York City alone, that is the highest group of people that are getting COVID is the pediatric patients. Now, we can only vaccinate between 5 and above, but that age group under 5 are still the ones that can get it, have a little bit of run of their nose. Everybody think, oh, this got a little virus, don't worry about it. But they might, in fact, indeed have COVID or some other viral things along with COVID. They can have COVID and another viral thing. So they bring it home. People think nothing of it. Big mama give them a little something for their cold, and unknowingly, they're spreading it. So I would say, if you're going to have something like a reception at your home, check that people are vaccinated. Make sure that if you have the testing, and the masks have to be worn. But not only the masks have to be worn, they have to be worn properly. Not underneath your nose, up your chin. People that are bearded got these things up your chin, and get away from the cloth mask. As we said earlier, no reflection on you, Brother DR. But as we said earlier, we got to stop using the cloth mask because they're not going to be effective against the Omicron. Omicron is going to laugh at that. Say, okay, next. So we got to think about it. So if you're going to have something in person, my recommendations to people are, and these are just my opinion, my recommendations are have a test a couple days before, the day of, make sure everybody's properly vaccinated, check temperatures, and have as small gatherings as you can, and have an adequately ventilated area if you're going to be indoors. Outdoors is a little bit different, and you're not as strict as it, but don't forget about the ventilation piece. So if you can't be in places properly ventilated, no indoor buildings where there's no windows. If you're in house and you're going to gather and you have a window, if it's not too cold and won't affect your electric bill or whatever your bills are, open that window so you have some type of ventilation in there, because we know that the Delta certainly spread by aerosol droplets, and Omicron spread the same way, with maybe a little bit of surfaces as well. So you got to keep all those things in consideration. So that's just my take on it, Brother DR.
We getting close to running out of time, and as you know, it's always all this information, great information. We just never have enough time. Let me just ask the doctors this, and then we're going to get to everybody's final comments. And I think it was one of the questions. We also want to get to some of these questions in the chat as well. But I think somebody had a question, just in general, Omicron, as it relates to either the common cold. There seems to be some people seem to think that it's not as bad. or it's just like a common cold. Why are we making such a big deal about it? So let's just start from you, Dr. Boykin, since we're on here, and then we'll go to Dr. Phillips and
Okay,
we'll
one of the
talk
things we
about
do know, one of the things we do know about the Omicron variant, it has some of the DNA of the common cold virus. One of the common cold viruses is coronavirus. So there's thought that this is probably why it gets into there so fast and so quickly. But the other thing, somebody asked in the chat about the spike proteins, qualifying as spike proteins. Spike proteins are those things on the surface of the virus that attaches to the cell that makes it makes the virus be able to invade the cell. And the thing about Omicron, it has so many mutations in that spike protein, it can get in more easily. So that's the other thing. And probably because it gets in so quickly and just kind of bypasses things, the body doesn't have a chance to react to it. So you may not see it as deadly as the Delta. So that's probably why I say it's probably less. We do know it doesn't cause a lot. And we know the incubation period now is probably within 3 days. It's in there, it hits it, and it quits it. So it's in there and gone within that period of time. So that's probably why it seems to be less severe. We don't have all the data yet on Omicron. We have a lot of data on it, but we don't have all the particular data on it. But I think that it's something that human bodies probably gotten used to the cold virus over the years because we had it from day one, if you will. But it does have some of the DNA of the cold virus. That's probably why it can get in so quickly and be so minimally expressed or minimally looked at. And somebody asked, how can you become a COVID-19 ambassador? Well, you have the community COVID-19 groups out there. There's plenty of places, faith-based communities out there. A lot of your ministers and things like that, community things, are having just those particular things like this. Very easy to get involved. I don't have the links with me right now, but I'd be more than glad to share some links how you can become involved as a community COVID-19 community ambassador, or on the faith-based calls that we have from the Department of Health and Human Services by way of the White House. So I'll just leave it at that, brother. BR.
I would just add to what Dr. Boykin said. So with the patients that I've been seeing over the past week, of those that I've diagnosed with COVID, I'm not seeing any fevers. I'm not seeing any body aches or abdominal pain. What I am seeing is my nose been running a little bit. My throat is scratchy. It may hurt. I got a little bit of cough with some phlegm. And unfortunately, the other thing I'm seeing is people trying to throw that. I think it's just my allergies. They throwing that out there before they go get a test. And like we were saying earlier, like Brother Gardner has said and everybody else has mentioned, you may live in a space where you have other people that you are exposed to that are potentially vulnerable to COVID. So it's important, even though you got a little scratchy throat, your allergies may be acting up, what you're not counting is, damn, I did go watch the Redskins Cowboy game with the Bros on Sunday, and it's important, if there is that question, go get a test, because it is the gift that is given in such a high rate that you may give somebody something they can't get rid of.
Dr. Waddell.
No, I would just echo what they've already said. I would also add that sometimes saying, certainly we are grateful that Omicron, with the data that we have now, does not seem to give a severe infection in the sense that people are hospitalized and have to be in the ICU. But in terms of what's recommended, in terms of quarantining and safe distance, it's not based on the variant. So you may have Omicron vaccine and not be hospitalized. You're still, if you test positive, going to have to, at a minimum, isolate for 5 days. So it still has an impact economically. It still has an impact potentially on our students if they can't be in school. So we need to still take this seriously. Even though it may not lead us to hospitalizations, it still has a significant impact. And just to also add, I agree with Dr. Boykin. Certainly, you can become an ambassador by being involved with various organizations, but you can also become an ambassador simply by saying, look, I was nervous. I was concerned about getting the vaccine, but I got it. After the shot, and I've traded stories with people, who had the vaccine, and after the second dose, I felt bad for 24 hours, but you know what? Now I'm good and I feel a lot more comfortable. I'm less stressed about where I go. I'm less stressed about what I do because I've been vaccinated. So I think as we talked about getting on people's levels, just sharing your story that you too had concerns, but you went ahead and did it, not only for yourself, but also for the people that are important in your lives, for the people that you want to keep helping make your life convenient. You want to go to the grocery store and have somebody there to help you. You want to go other places. You want to get your Amazon packages. Those are people out there making your life convenient. So if you don't do it for anybody that you know personally, do it for the people who you want to help make your life more convenient.
Outstanding. Dr. Guyton, I'm going to let you respond to that. I think you got a question in the chat, and then you can also go ahead to your 1 minute closing. Dr. Guyton.
So for me, I'm excited about the fact that we have addressed being a COVID ambassador and taking it down to the simplest level. You are already a COVID ambassador. If you've been vaccinated, if you understood and listened to the correct and accurate information, you tell your story. That's the best COVID ambassador. But if you need more information, as I've done in other webinars, the surgeongeneral.gov, the Surgeon General put out a great report on disinformation and misinformation. And in there, he laid out a roadmap on what you can do in your organization, whether it's a church organization, fraternal organization, whether you are a teacher, a provider. There are ideas and everything that are in there on what you can do within your organizations. That is a great document that I had a chance to review and look at. My closing, I would like to say, for the question below that was asked, supplements play a great role in making sure that you have a strong and very, very just immune system. I myself, at the beginning of all of this, because I worked every day out in the communities, I myself was on vitamin C, zinc, elderberry, vitamin D, all of those things that magnesium, all those things that help infuse and protect you and help with your immune system work very well in helping you keep a strong immune system. Now, understand, they do not and will not prevent you from catching the coronavirus. They will help you if you do catch it in some instances where it strengthens your ability to react to it. Again, I still on a daily basis take elderberry, vitamin C, zinc lozenges, and vitamin D, which I also use for my prostate. So those supplements are helpful, but we don't want to put the information out there saying that they will prevent COVID-19. I'll close by saying, become a COVID ambassador. Tell your story. Start from your heart. Reach out to others. Do not make it about them impacting your life in a negative way. Make it about how they can impact their families and their communities in a positive way. And I promise you, you will see changes within your community. Start with one person at a time, as I did. Impact their family, because one person is going to save another 3 or 4. I'll yield there, Brother Dion.
Dr. Guyton, as always, man, we appreciate you. Thank you so much, and continue to stay safe. Happy holidays, happy new year, all that good stuff. We're going to go to 1990. Brother Gardner, please, your closing remarks.
Brother DR, I appreciate this, but more importantly, I appreciate my fellow horsemen and our guest speaker tonight. I know we're all tired. I know we're all worn out and we're stressed. But now is not the time for us to let our guard down. A question was asked earlier about meetings. I want to echo what Brother Boykin said. I want to say this emphatically. Now is not the time for in-person meetings. There are a lot of things out there we can do because we've got to figure out how to work in this new environment, but we've got to remain safe. And like I said, we all are worn out. But as the good book tells us, the race is not given to the swift, but those that endure. We're in that enduring moment right now where we've got to stay focused on the prize. The prize is not us individually, but us collectively. I'm so proud to be associated with a fraternity and a group of young men and women who are concerned not only about themselves, but about society. You may not think you're making a difference, but as an ambassador, as my brothers have talked about it, if you just touch that one person who might go tell someone else your story or their story, because we've all been impacted. You guys know my story. This is a healing thing for me. It's like therapy to know that there's some people out there on the front lines who are trying to make sure that we do good for others, not just for ourselves. There's no big I right here, but it's all about us because the only way we're going to beat this is for us to be together. I remember talking to a young lady in the airport, and her mother had passed away from COVID, and I shared a couple stories that I had with my tragedies. And it's amazing how you can meet a stranger, and for that one brief second, you know how each other feels. You don't even know this person from Adam to Eve, but for that one brief second, you're joining, you're united at the hip. I want us to be joining united at the hip for a long time, fighting this pandemic, make it to an endemic, and make it to a point where we can all go back to what we want to do. We want to get there, but the only way we can get there is if we do this together. Together we will fall, or together we stand. So, Brother DR, on that, on behalf of all of us, I want to thank you for this meeting tonight and how we do what we do, and hopefully we reach just that one person that we can save them, who can then save their family. So, thank you very much, Brother DR.
Thank you, Brother Gardner, as always. We appreciate you. And we're going to go to our guest, Dr. Waddell Jiggets, for your closing remarks. And I will also say, well, we're going to save that for Dr. Boykin. I see that comment in there from Brother KC as relates to the schools and the youth. But either way, Dr. Waddell Jiggets, your closing remarks.
No, again, I just want to thank you for allowing me to participate in the panel. I apologize for the technical difficulties. And again, I would just like to encourage everyone, especially women, pregnant women, to please get vaccinated. Again, I understand concerns that have been raised mainly due to misinformation. But the vaccines are safe. And in getting vaccinated, you not only protect yourself, you protect your newborn, you protect family, you protect other members in the community. And so again, I would just strongly encourage folks to get vaccinated. Thank you.
All right. Thank you so much for joining us. Let's go to 88, Dr. Jedan Phillips, for your closing remarks. Dr. Phillips.
Yes. Again, was an honor to be on this panel discussion, talking about this critical thing. I think I echo what everybody else just said. We got to take a more intentional role to get all of us out of this. What we have seen thus far, there's no comfort in just you being vaccinated or you being safe. If your grandmother's not safe, if your next door neighbor is not safe, if your 2-year-old child is not safe, then we are all vulnerable. The other thing is, as this starts to fester and get worse, unfortunately, it affects people in other ways. Imagine how you feel if you're a person that has a lesion in your breast that may be cancer, and they're talking about they may not be able to do the procedure when you're supposed to be doing it because of institutions closing down because of the rising COVID numbers. And that's just one example of many similar circumstances. So again, if we want to get out of this, we're going to have to do for us, not just for me, as it was just said. So with that being said, mask up, avoid unsafe situations, get your vaccine or booster, or find out and get questions answered by your doctor so that your reason, if that's what you choose, even though that's not what I recommend, is not based on, I'm afraid, I'm just going to wait and see. Have some specific data that is relevant to you. And the best place to start with that is getting that question answered by your doctor. For our healthcare providers out here, I know we want to rush through and get the patients in and out, but we may also want to take advantage of those moments and ask them, did you get your shot? If you didn't, why didn't you? Is there any questions I can answer for you? Is there any information that I can help you search? Because again, even though it seems very easy for us to find this information, it's not that same way for everybody else. And unfortunately, as we've identified on many occurrences, healthcare disparities, especially the lack of quality medical care in communities of color, is a real thing. And because of that, that is unfortunately contributing to why communities that look like us are the low-hanging fruit when it comes to this pandemic. So with that being said, I yield my time.
Thank you so much, Dr. Phillips. And last and certainly not least, 78, the spearhead. He gives us the facts. He gives it to us straight. Dr. Boykin, please, your closing comments.
Well, like I said, there can be certain outliers in any particular vaccine or thing given, and people are out there spouting about vaccines not even given in the United States. So I'll just say that, no one in the United States is receiving the AstraZeneca vaccine right now. So let me just put that out there. So the information about it being maybe for other countries, but not the United States. You certainly do need to get your flu shot, because the most vulnerable populations in the flu shot are going to be those young people. They have the highest risk of death and complications from getting the flu, as well as the elderly. So get your flu shot, because the flu isn't running rampant right now. No vaccine, and I'll say that again, no vaccine is going to be 100% preventing anything. If that was the case, we wouldn't have to do anything but make vaccines all day long. So no vaccine is going to be 100%. And the COVID-19 vaccine is certainly not one out there to prevent you from getting the disease. It just decreases severity and death. In terms of the children getting home, being sent home, we have so many pediatric cases out there, and so much of impact on the school system for the kids, the mental health of the kids, and the development of the kids, that we came up with some kind of way, not me, but some kind of way was come up with, so we can try to get some of that mitigation so the kids can stay in school. That's what we have called the test to stay in school. So you're going to find cases out there where if a kid is not symptomatic, but has been exposed, they can stay in school following this test to stay care. And I won't go into the details of that, but that's one of the ways we can do it. So please, please, please consider information you give out there to research it and give adequate information. Don't be giving information from a single isolated case, because only information I put on here is readily available to anyone out there who wants to look it up and see that it's out there. So for our kids, consider that they cannot be vaccinated. And some parents choose not to get vaccinated. That's vaccination is certainly a choice. And we're not here to beat up on people and say take the vaccine, because it's certainly a choice. But we have an answer to a way to put this pandemic under control. So with that, I yield back my time.
Well, as always, Dr. Boykin, thank you so much to all our horsemen and to our guests on tonight. We just want to say thank you. In closing, to all of our guests, all of our family members that are present, we just want to say thank you. Let's continue to fight this pandemic together. If you are not vaccinated, obviously, we strongly encourage you to get vaccinated. All of us are vaccinated and boosted. And so with that, we want to say have a great new year. Certainly, I will say on the behalf of the American Red Cross, please, if you have not donated blood, please take the time to make sure you donate blood. Again, my name is Kelvin Pofo, and I serve as the district representative. Thank you so much for joining us. We'll be here on the last Wednesday of every month. So we'll see you in the new year. Good night, and God bless.